All right, LinkedIn. We couldn't be any more excited to have this conversation. We are online and live with Jean Hitchcock, who tells us this is her first LinkedIn Live session, but definitely not her first rodeo in healthcare. So Jean just brings a tremendous amount of experience to the industry, 25 years experience working at great organizations like OhioHealth, Scripps Health, leading marketing efforts at places like MedStar. And then Jean, how many, just across the nation, how many organizations are you working with right now?
Well, me and my team, we've got about 20 active clients right now across the country, mostly on the east to the Midwest to the East Coast.
So just fantastic background with leading organizations, and now taking that broader perspective, being able to work with health systems across the nation. Mm-hmm. One thing that we've seen as a major challenge is all the marketing efforts that we do, what we invest on creative, what we invest on the campaigns and different things that we launch. How do we value those efforts? How do we rally the organization around what it is to put the patient at the center of these communications and these efforts? So we're really thankful, Jean, working on an extremely busy schedule, especially with all the engagement that health systems are having to do right now. She's taking some time to sit with us on this LinkedIn Live session. So the way that we want to structure this, the reason that we're using LinkedIn Live is because the conversation isn't just between me and my fantastic co-host Brad and Jean. It also includes you. So what you're able to do on LinkedIn is drop us comments. I like when people drop in the likes and the shares and things like that, but comments and questions are welcome. This is your opportunity to hear directly from experts and legends within healthcare marketing. So feel free to interrupt us with your questions as you see fit. So Jean, just to get started, like I brought up just the history that you have with healthcare leaders and all the information that you're collecting right now. But the counterbalance is that metric-driven marketing is new for a lot of organizations, and a lot of people might not have had their training or schooling in that. Mm-hmm. So I'm just trying to, just for the audience, trying to figure out what would you say are the basics in communicating marketing results with leadership?
Well, to give you a little perspective, and you're kind by saying 25 years experience, but there was a time when marketing wasn't even a department in healthcare because you didn't need to market. So there are, in this day and age, if you're not measuring results in dollars to the bottom line, you're really behind the eight ball. I find very few marketing departments that haven't jumped on the MarTech, digital marketing, and really being a partner with finance on showing how they make contributions to the bottom line. If you're not doing that, you're really doing marketing from maybe 2 decades ago. You have to show results.
Fantastic. So what you've seen then is not even the question of how to show results, but even a question of whether or not to show results at all.
Well, you know, you go back to that old adage about the shoemaker's kids have no shoes. I can't tell you how many marketing departments don't market marketing. Mm-hmm. You know, if you're not reporting out to your board quarterly about all that you're doing to build your brand, you're missing an opportunity. Because if the only time they hear you is when you ask for budget and they don't know what you're doing with the money, you're not going to get the budget. So you need to report out what you're doing, and it needs to be a comprehensive reporting out. You know, people used to think if they reported out how many clicks they had or views they had on a website, that meant something. No. They got to sign up for an appointment now. They've got to schedule a test now. They have to select a physician now, you know, and that's the kind of real business success that you need to report out through the entire attribution period for a service that you decide to take to market.
So Jean, how do you, I mean, you know, a lot of folks probably out there are like wanting to do this, right? It's not a necessarily an issue of wanting to be able to show value for their efforts, but there are going to be internal hurdles that they have to kind of jump over or crawl under, so to speak, in many cases. What do you see as kind of the central themes around that? Like, you know, either in your own experience or what your team's doing from a consulting standpoint, are there some consistencies that you see across different healthcare organizations around wanting to share the value and the data, but not having the ability to do it?
Well, if you don't have the ability to do it, I'd say get it like yesterday, but think about what you already have in place. So you talk to your CFO and you say, what do you think the value of a primary care patient is? Because for every physician referral that you provide, you should be quantifiably recording that. So I think it was McKinsey says it's worth about $6,500, discounted by 50% for reimbursement, $3,200 a pop, right? So you have a new movers program. How many of those convert to actual new patients, right? And then most people will tell you that you probably market 10% to your existing patients. You need to really mine your own data. Go into your medical record and find out exactly who you're treating now and some predictive modeling of what services they might need in the future. I'm a classic orthopedic patient. I will go until I hurt so badly that I'll finally get something done. And that's exactly what I did, you know? So if you know that someone's been complaining and been taking medications and having treatments for sore joints, they're a perfect person then to identify for orthopedics down the line. So mine your current client data in your medical record, look at new movers programs, look at physician referral, whether it's in your call center or requests to your website. And then volumes for things like ambulatory. Ambulatory is really a rich area. If people have a choice to go for services, scans, or whatever, really set up ways to track new patients to that you didn't have before. So there are things that if you don't have a whole big MarTech stack, you can do. And then once you start getting into CRM and things like that, you can really get very, very granular about where you're picking up people, new physicians who are referring to your organization, which of course is gold and growth. And that's where you really need to focus when you start developing and maturing as a marketing department.
Jean, so you hit on some really interesting points there. And I have a feeling that there's a lot of people who might be watching and saying, hey, yeah, I was showing metrics across the organization, or I was sharing this information, but they still weren't able to get leadership to understand or move or value the efforts. So I'm just curious on where you've seen communications about metrics going south. Like, hey, I don't necessarily trust the numbers that you're putting out, or I think that these other efforts were more impactful than your marketing. So where have you seen those communications go south, and what's your advice in those scenarios?
It goes back to what I said about marketing, not marketing. I mean, if you think about it, and a CEO told me this one time, he says, I've never had a marketing person come to me that told me they could help me meet my bottom line. Well, if we can't help them meet their bottom line, what department can? Second thing is build your partnerships with the CFO and the CIO. With all the digital stuff you need, that CIO had better be your partner in crime. And the CFO you need for that purpose of credibility for the results when you report out. So when you talk about where did the communication go south, if you haven't started really proselytizing a little bit about what marketing is to IT, finance, and to your leadership, start there. Then make sure that they understand you are going to be their partner in hitting the bottom line, and you're going to show them how you're going to do that. And there's a process you go through to select what you take to market. I always have planning, the CIO, and finance at those sessions, because I found very few physicians, when I ask the question, is it profitable what you do? They look at me like, I have no idea. So you have finance in the room to tell you what makes money and what doesn't make money.
So if you look at that, Jean, kind of per our earlier conversation today around, where the market is now with post-COVID, or, coming out on the other side, I can harken back to during meaningful use, the CIO went from, keeping the servers on and keeping everything, managing the EMR, to the most valuable C-suite in the hospital, right? And the ability to hit meaningful use and those types of pieces. Do you see that same paradigm shift now on the outside of COVID, where now we've got chief marketing officers coming to the forefront of, hey, in order to increase growth and to drive volumes back into our health system, we've got to have the ability to do that, and we need a plan to do it? Is that an equitable comparison, I guess, in your mind?
Yeah, I think we are in a very unique time right now. I mean, everybody from your healthcare provider to the guys who sell heating and plumbing are telling you how they're doing it safer and it's okay to come in and use them, right? So they're going to assume that you're doing it and you're doing it well. But remember, they saw pictures for the last couple of months of how battered the hospitals were. So you absolutely have to start with that message of, we're here, we're open for business, we can take really good care of you, your health is our primary importance. But absolutely, if elective surgeries were turned off, as it was in every part of this country, and they're turned back on, which ones are you going to take to market? And that's where you have to do that grid, the criteria grid of what to take to market. What is going to give you the quickest wins that you can build upon going forward? People talked about what happened to all the heart patients in the EDs during COVID. They just didn't appear, right? Well, they didn't go away. What about diabetics? What about people who were supposed to have mammograms and PSA tests and stuff? They put all of that on hold because they were staying in place, right? So that is all rich patient caseloads that need to be energized to come back and take care of their health.
So Jean, well, first of all, thank you to the audience for the comments and questions that are coming in. There's one that I thought was really relevant to what we're talking about here, because you're talking about building coalitions with IT and with finance, so that when you're coming to those meetings, when you're coming to the conversation, there's already some buy-in and understanding on what's going to be presented, and then you can go through with that process. But on the more basic, so a question that we got from the audience was a system, an organization. How do they know that they're ready for the reporting, predictive analytics, and some of the more advanced things, the things that rely on data science? How does an organization know that they're actually ready for moving forward with these kinds of systems?
Well, I'll go back to the fact that you have to start somewhere, and you have to start with what you have. Do you have your own call center? Do you have a call center? Do you have online scheduling now? Take a look at what you currently have, okay? MarTech stacks can be built like Legos, okay? CRM systems are all different. If you have a really robust call center, you're gonna want a CRM that really does a very easy interface with them. If you have an organization, that's the technical piece. The organizational behavior, though, also comes in, and this is why the consensus with the CIO is so important. There are some organizations that are really, really strict about access and integrating and API shooting data to different systems. That's why that partnership with the CIO is so critical. Because if you're going to mine that data for marketing, they need to have assurance that that is protected. So you might have to incrementally take advances in some areas based on how open your organization is to integrating systems or not. And then the other thing is everything costs different amounts of money. A new movers campaign isn't that much money, but a new movers campaign that's tied to CRM, that's tied to a call center, which is really the Cadillac of what you want. Maybe we should be saying the Tesla of what we want.
Yes, Tesla now.
That's going to take more money. So part of it is assessing your organization's readiness to take this on. The second piece is, what do you have in place now that you can build upon? Are you all on one medical record or not? Do you have to jerry rig the medical records? A lot of people have a different outpatient medical record than inpatient. And then do you have a CRM system that can handle that? Or whatever it is, online scheduling, whatever it is that you want to look at. And have the vendors come in and show you what they can do, and have them answer questions for you around ease of integration, cooperation with IT, security of data. They get these questions every day, so they're very willing to answer it. But that's how you have to really assess whether you're ready or not.
Wow, I love that answer, because it focuses on first the coalition building needed to address the problem, and then one really good impact of building that coalition ahead of time is that you don't have a lot of the repetition of technologies. Like if the API gateways are centralized and you're having conversations with IT early on, then it reduces a whole lot of the duplication of those efforts. So
right.
Yeah.
One question that CIOs sometimes bring up, and I'll just say that because it's come up a couple of times this year, in a perfect world, they would like to be all fill in the blank. Microsoft, Adobe, Salesforce, whatever. Well, life just isn't that homogeneous anymore, So when you come up against a CIO, and that's probably too strong a word, who has that belief, you have to educate them about why going a different way makes sense from a marketing perspective. They don't know marketing. You don't know IT as well as they do, but they don't know marketing like you do. And you need to explain that to them. I have had more conversation with CIOs about the fact that I'm not going to put 37 things hanging on your chassis. I'm going to put a cohesive program together on your chassis because it meets my needs, but it will not impact or upset what you're trying to do. So that's why those coalitions are just so important to have up front, because when the vendors come in is not the time you want to find out that your IT department is really not open to this.
Mm-hmm. Great. And yeah, it goes along. We got another comment. Heidi Lee Munson kind of points out and agrees with you on how the CIO relationship is a big organizational win.
Oh, absolutely. I will tell you that one of the top 5 organizations in the United States that's near me hired a CMO in the last year and a half, and they had the person lined up for interviews with a number of people, and her comment was, I don't see the CIO here. I have to meet with that person before I will consider taking the job. And that just shows you the shift, in how that's going forward, because she knows how important that's going to be for her going forward.
So we harped on coalition building and some other related skills that kind of help you help prepare people to see what you're going to bring to the table ahead of time. Mm-hmm. But I'm curious, what are some other skills that you would say that people need to have in order to produce trustworthy results where the rest of the organization believes in the results that marketing is outputting?
Well, I'll give you an example of what people used to do and why it didn't serve them well. People who used to judge public relations by the amount of space in a newspaper and what the equivalent cost would be of buying that space and ad value, that is an old metric that doesn't mean anything. And so people would look at them going, well, we wouldn't have spent that money anyway. What you do now in PR is you say, if we're going out with a program around our brand or around heart, then any news stories that are positive, we're going to get credit for. Neutral is a different rating. You grade the PR you have now based on how well it's aligned with philanthropy, maybe human resources, and marketing. It's a very different way of looking at it that you've ever had before. And that's why I think you need to look at what is the organization going to believe, which is where you get the value first. And you never do a marketing plan without a measurable goal. If this is your goal, what are your measurable metrics you're going to have? And you say, this is what we're going to do.
Now, speaking of getting to that point, when I'm starting to ask myself, what are my measurable goals? What am I planning to do? Do you have any advice on where people should be looking to get started with these efforts? Is there a particular service line or particular offerings that you've seen repeatable success, like as good starting points, or where should people start this process?
Well, obviously new movers is always a great place to start. And in Phoenix, forget about COVID, but Phoenix, for example, was the fastest growing county in the country. So new movers made perfect sense. There's other parts of the country that's losing population, so that wouldn't make much sense. I use a 10-point criteria of what to take to market. And it has things like, is the patient experience good? Does it make money? Are we clinically strong in that area? Probably the biggest piece is, do you have any capacity? The worst thing is to market something and people can't get in. Is there a physician champion who can make changes? If the patient experience isn't good, is there a doctor who can make it better, type of thing? Is there spin-off revenue from this service? Mm-hmm. IVF is one of those, in vitro fertilization programs, is one of those things that has tremendous spin-off because of labs and what have you. So you have to take a snapshot of where you are, your organization. And then the big one, which I think a lot of people are going to have to focus on more than they've ever had before, and because I came up through operations, I recognize how the ops people are so crucial. What is the throughput, which goes to patient experience? So for example, during COVID, you weren't going to get a lot of IVF lab tests going through pathology with all the COVID tests they had. You had to really understand what was the patient pathway before you could design a campaign that was going to work. I'm sorry.
That's a big part of it too, Gene, is the ability to look at capacity. And while we come out on the other end of COVID or where we're at currently and looking at growth, there still is a limitation to how much we can handle throughput, so to speak. So how much is that? Is that part of that data conversation and the collaboration with the CIO and with the data that we have available to us, is looking at capacity and what can we realistically kind of fit in from a scheduling standpoint?
Absolutely. And healthcare has a horrible history with estimating capacity. Mm-hmm. I cannot begin to tell you the numbers of times I've had people come up to me going, we just hired 3 fill in the blank, and now I've got to find patients. Any business in America wouldn't have hired 3 superstars at that kind of salary range without having part of the business in the door already. So we're already at a deficit going forward. I've never met an independent physician tell me that he or she was at capacity, because they have to kill what they eat, right? Mm-hmm. And then the converse is true, is some employed medical groups want to diminish their capacity because they don't want to have a full panel. So it's one of those delicate conversations you have to have with your providers about capacity in a real honest way. And again, there's nothing worse. I always use the retail analogy that if Nordstrom's had a sale and they didn't staff extra for it, you'd say, didn't they expect we would show up? Of course. Right. And yet when you look at how hospitals do lab work, when you can't eat anything after midnight, when does everybody show up for their lab work? 7 a.m. Do we double or triple our 7 to 3 shift? No. We staff it the same way we staff it the good ones do. But I can tell you, I've had to learn that lesson the hard way. So, so capacity is huge.
Yeah. I think we've seen that as well. And another thought I was kind of thinking through some of your dialogue is, what are you seeing in the groups that you're consulting with or talking to, messaging and tone, brand awareness of kind of who you are as a health system. How are you consulting them that, as they start to engage patients or consumers again, what does that tone look like? Because it's, obviously you're seeing a lot of safe to return type initiatives, but what are you seeing out there in the marketplace? I'd be intrigued to hear.
Right. Well, it's an excellent question. So any good brand management program has got a message platform in it. How are we talking to our employees? How do we talk to our doctors? How do we talk to the community? In the COVID era, those messaging platforms are what used to really support your brand positioning. And so you have somebody who says world-class care, or everyone deserves world-class care. I'm just picking out, when you see the images on TV of these ERs and of these first responders dying on the vine because they didn't have the equipment and they were overloaded, that's a disconnect. Mm-hmm. So you might have to change your positioning. You might have to change your messaging going forward, depending on what you're going out with, right? Now, there have been some brands during COVID that have really, really enhanced their brand. Mount Sinai, Johns Hopkins, Cleveland Clinic. These are folks who have really been able to shine a light on how good they are through the work they did and the media coverage they had. Their doctors were everywhere, kind of thing. So their positioning was evolving through the PR that was happening with COVID. And in smaller markets, of course, it's the local hospital usually that does that. But there's still people now on, there's a TV news show I watch. They always start out with interviews of people who are on the front line. And it's not a pretty story. They're hot spots. So someone watches that and you say, well, is it okay for me to go in and have my knee replaced now? I don't know, The other thing is a client of mine, we're doing 20 questions to ask your provider to get comfortable about going back, and we got pretty basic questions there. But you do what you have to do in your market, and it just depends on where you are. Right now, Arizona, Texas, and Florida are in very different places, for example, than Chicago hospitals or New York hospitals. And that's kind of the comparison you have to recognize.
So actually dovetailing off of Brad's question, so he was talking about like the communication type and the engagement. I'm curious if that has, if the pandemic has also impacted the types of metrics that people are looking for, and some of the things, some of the new things that people want to measure. Just curious about what the ask there typically is.
When you say when people want to know, people on the inside, not the public.
People on the inside, yeah, people on the coalition containing marketing, yeah.
Well, I think what's going to happen is people. I mean, every hospital I've talked to is bleeding money because the electives were cut off and people weren't coming for care. So the success for a lot of people is volumes, new patients, new doctors who are referring to them. Now, those aren't different than what they might have been before. But the other thing is going to be the retention metric. Did we lose patients in COVID? You know, are people not coming back? So when you start to send out reminders through CRM that, Jean, it's time to come in for your mammogram or whatever, and people aren't coming back, that would be an indicator that there's something wrong there that you need to address pretty quickly.
That makes sense. So that kind of leads to another question, just as far as like we're seeing these changes happen, we're seeing these transitions. What are, so like in the journey of moving towards a metrics driven marketing organization, what are some of the challenges, some of the other challenges that you're seeing?
Besides not having the technology?
Yeah, the technological issue. Yeah, well, maybe some of the specifics around some of the technology, or just seeing if there's like anything that we can dive deeper in terms of like the coalitions that we were talking about, or the technologies, kind of any kind of tangential.
Yeah. So there's two things that stand out that we haven't covered that I think are important. One is the skill sets of what you need in staff are very different now. And a lot of people have staffed their departments in what I call traditional Marcom ways. You know, you will never have enough staff to create all the content you need. So content is one of those things I always say to people, think about, you know, outsourcing that, because you really need to have different kinds of people steering your ship that you don't have right now. And they're very hard to find and very competitive. The second thing is physician leadership. The other partner in those coalitions are the physician leaders. Every physician has an app they want you to look at. They want to do a blog. They want to do this. They want to do that. And they want to help. They want to be part of it. And I love that. And I welcome that. The challenge is they don't really appreciate how much work goes into getting all of those things done. Now, if you are a program, a hospital that really promotes your heart care, does it make sense for you to do a heart care blog? Probably. Would it make sense for you to do a podiatry blog? Maybe not. You know, it depends on who you are, and you got to pick and choose the priorities. And I used to hearken back to, I come from a family of 6, and my mother would say, I love all the children, but the kids have different talents and strengths. And I say that to the doctors all the time. I said, you know, you're all wonderful. You're all bright people. You all do great work. You take care of wonderful people. But now we got to do gastro. And here's why. They have capacity. We can make money. We have a competitive advantage of doing it, blah, blah, blah. You go down the list of reasons why. They get it once you give them the criteria that everybody else is being judged by. So it's not the squeaky wheel who's getting the money and getting all the attention. It's
Yeah. Jean, is that your nice way of telling me that I have a face for radio?
No. But I remember I have a sister who is very artistic, and it was the last thing my parents could understand because that was not their backgrounds. You know, they had this child they didn't know what to do with because she was so artistic, you know. They were smart enough to let her go do her own thing, and she was very successful. But people have to recognize not all services are created equal. They're just not. And if the patient experience isn't good, people aren't going to come back. So all those things have to be taken into account.
So we've seen some of that, and some of the work that we've done with clients around more personalized provider outreach to patients seems to just gain so much more insight and engagement. You know, if you were, you know, meeting a new hospital today, do you feel like the health system is marketing themselves, or, you know, it's marketing their providers because that's who's providing the service. So, is that relationship as part of, growth strategy, recovery from COVID, is it really centered still in your mind, or do you see it in the marketplace around, it's still down to the base level of the relationship of patient and provider?
So when you finally leave being on the inside, which I did finally in 2014, I shouldn't say that, through a family situation where we became up close and personal, through a trauma situation, people have relationships with their doctors. They can overlook a reputation of a hospital that might not be as great if they have a wonderful experience with their doctor. I think the fact that telemedicine took off in 48 hours once COVID hit, and the fact that people, I used telemedicine during COVID, which I would always say to people, I'm not the primary target for that, but I can tell you I really enjoyed it. And it was my doctor. The other thing is, I believe more my doctor telling me it's safe to come back than getting a letter from the CEO of the hospital telling me it's okay to come back. So that's just my personal opinion. And,
sure.
And maybe when you're in a large urban setting, like for example, when I was living in the Washington, D.C. area, I was going to 3 different systems for my healthcare for different things. I got 3 different letters from 3 different people within that organization, those organizations telling me it was safe to come back. But the only person I believed was my primary care doctor, who called me to tell me it was okay. So I think we have to be more personal than we've ever been, because we've had to be so distant. I just think it's going to be human nature.
And that harkens back to, in that coalition that we're talking about, thinking through the provider relationship as well, and the type of provider buy-in, because honestly, when it comes to conversion rates of email campaigns and outreach, it's astronomically higher, about 71% higher, I believe, including the doctor's name as the same as the brand.
The fun of being in healthcare marketing is getting to work with the doctors. I think that's always been what's been most fun for me. And once they understand marketing, they can be your biggest advocates. They'll be the people going to the CEO's office going, you need to give them more money. And here's why. I've had that experience personally, and I've seen it with my clients, that the doctor who has the power in the organization has gone to the CFO or CEO and said, look, this is what we want to do. This is what we're going to accomplish, and we need the money. You don't even have to make the case. They'll make it for you if you've built that relationship. And I think that's just critical.
Hey, Chris, I know we're close to the end of our time, but I want to make sure I get a chance to ask Jean this question. So there's the old adage of he who predicts the future lies, but I'm intrigued, Jean, obviously, having seen, the paradigm, right, of, brochures and bulletin boards to where now we're doing, telehealth and a lot of this focus. If you were to predict the future and tell us, hey, here's what you're going to see, in the coming weeks and months and years, obviously we don't think that the toothpaste can be put back into the tube with telehealth and those types of things. But any thoughts that you have as you kind of, that would be good for us to think about when we invest in companies moving forward?
Well, I had a marketing professor that used to tell me to always look for the person who was the first who did something, and then follow to see if the idea, what happens to that idea, whether it's electric cars, 3D printers, or whatever. So for marketing, my gold standard has been Amazon. When I think about how they went from selling books to recommending purchases for me, to now everything from financial products to owning the Washington Post. It goes on and on and on.
Right.
I think their insights into consumer buying habits is the gold standard. I think Apple has been somebody who went with the quality and never left that positioning. I once had somebody tell me that if Apple made white bread, they would buy it because that's their reputation, and they really work on that. So I look at those sorts of people that I am impressed by from a marketing perspective. But as a consumer, I'm also, I was one of those PC people. We're totally Apple now, kind of thing.
Uh-huh.
So I look at how they do it, and are there things that we could do differently? And years ago, I had an orthopedic doctor who said, I want people to think of my practice like a fine French restaurant that they'll wait months for. And I said to him, if I've got a bad knee, I'm not going to wait months. That shows you how much we've changed, where now people can do online scheduling.
Mm-hmm.
The consumer is really throwing their weight around in a way that they should have all along. And I just think it's wonderful.
Well, we are a little bit over time. And thank you again, Jean, for coming and staying with us. And thank you for the audience too, for the heart reactions and likes and questions and comments that you've given. In addition to that, one thing that we have that's really exciting is we have just over the next few weeks, we have really some amazing panelists and discussions coming up. We'll be focusing in with Intermountain Healthcare and their efforts around value-based care coming this Friday around managing chronic kidney disease. So you'll be able to have some perspectives on that. Then the week after that, we're going to shift the focus to Janae Sharp and her Sharp Index, which is a data-driven way of addressing and thinking about provider burnout. So that's the next couple of weeks. Lots of good sessions and content coming up. And before we close down, Jean, any final thoughts, or Brad, any final thoughts you'd like to share?
Just thank you for having me. And I encourage all the healthcare marketers out there, now is your time. Don't, as they say in Hamilton, take your shot. This is it. Don't lose your shot.
That's it. Shoot your shot. Thank you, Jean. We appreciate your time for sure. It was very insightful. Appreciate it.
Take care. All right.
All right.